I'm Zoe Garside, the Behaviour Analyst at Neuropedia. Today I'm going to talk to you about what is behaviour analysis, or ABA therapy, when to bring your child for a consultation or an assessment, and what we teach. So to start with, when should you bring your child for an ABA therapy assessment? The main reasons that parents bring their children to see me is because their children are not hitting developmental and behavioural milestones typical for that child's age. Also, if the children are engaging in more challenging behaviours than is typical for their age, or if they are engaging in very extreme behaviours or self-injurious behaviour. Parents also bring their children to see me if the teachers are struggling with their behaviour in school, or if the children are struggling with social skills with their peers. Also, your child does not need a diagnosis before you come for an assessment. I base my assessments on what I can see and the skills that a child has or does not have. Secondly, what do we teach in ABA therapy? So, when a child faces challenges, we need to look at both a proactive method and a reactive method to help prevent these behaviours from happening in the first place, and to reduce the future likelihood of a child engaging in that behaviour. The proactive methods that we use, we are rearranging the environment around the child. Some of the methods that we might use are to teach a child to request appropriately rather than screaming or whining. Also to understand and use language, such as following instructions, labelling and answering questions. We can also teach play skills and social skills. For the reactive methods, we will create an individualised behaviour reduction plan for any inappropriate behaviours that your child may be engaging in. We use an online data collection platform called Erasmus, which helps us to track that behaviours are going in the direction that we want them to, such as skills are increasing and challenging behaviours are reducing. Parents can have full access to Erasmus so that they can see exactly what their child is learning, how the child is progressing with the target skills, and also there's a new feature called Balance Parent Training, which parents can also access. Applied behaviour analysis is the application of the science of behaviour. We use the principles of behaviour to increase desirable behaviours and reduce or get rid of undesirable behaviours. If you have any concerns about your child or any of the things that I've mentioned within this video, you can always come and visit me at Neuropedia.